Podcasting from Dallas, Texas, I am Shireen, and this is the Yumlish podcast. Yumlish empowers people with chronic conditions like type 2 diabetes and heart disease to take charge of their health through diet. And this podcast is created to amplify the voices of patients, health professionals, employers, and community members who are working to reduce the risk of these chronic diseases and put your health first. Registered dietitian Sandra Arévalo speaks to us about her career in dietetics, what it means to care for the patient over the diagnosis, and what patients can do to be empowered in their journey to better health. Sandra Arévalo is the Director of Community and Patient Education at Montefiore Nyack Hospital. Working as a bilingual private consultant, researcher, and spokesperson has helped her expand her horizons to continue her mission and commitment to provide healthcare to the most underserved and diverse families. Welcome, Sandra.
Thank you, Shireen, for having me here.
An absolute pleasure. So, Sandra, I want to dive right in, and I want to start out by asking you what really led you to a career in dietetics and working with people from different cultures and backgrounds?
Well, I think everything has started since I was a little girl because, not so little. I was 15. I'm originally from Colombia in South America. And I was very lucky because my father had to travel internationally a lot. And, we are a very close family. So I started traveling with my family and we traveled through a lot of countries, first in Latin America. Then a few years later, we were able to move to Europe and I was living in Holland for over 3 years. And then from Holland, we used to travel to like many other different countries. And, being always an international girl in a foreign country, you make friends who are international as well. Most of the time, that's how it happens. So I had the pleasure and the advantage, I think, of growing up with people from many different parts of the world. Like, for example, when I was in Holland, I had friends, obviously from Holland, but also from Chile, Spain, Suriname, Africa, India, so I've always lived in language, like find a way to communicate and play around with everybody. So I think that's how I became so passionate about diversity and cultures and all of these. And then, later on, I definitely wanted to be in healthcare and start doing something in healthcare. I just quite couldn't find what, my true, passion was in healthcare. I knew I didn't want to be a doctor or a nurse, but I definitely wanted to be in healthcare. And then I found nutrition, and nutrition, it's so diverse as well because you can do so many things in nutrition. You can food service, but you can be a clinician in public health and research, so it's also a variety of things that you can do. And, and especially food. And I love cooking and I love healing and I love prevention rather than disease. And I think that's why I couldn't be a doctor. And nutrition provided me with that, like healing and prevention and how we can use food and culture to help people live healthier lives.
How interesting. When you, through one of your interviews, you mentioned, caring for the patient and not the diagnosis. I want to go right into that and even touch upon that a little bit to say, what does that really mean from both the patient standpoint as well as from the provider standpoint in your approach?
I think that approach is not that different for both the patient and the provider. A person is a person. That's what I think. And unfortunately, the way that medicine is practiced overall is like we practice a disease, and especially, for example, we talk about diabetes, right, which is our interest here, is like, I'm going to treat the diabetes. I'm going to know if you have diabetes, now which medications you need for your diabetes, if you need insulin, how many units do you need, but you're not thinking about the person per se. You're thinking about what the disease needs. You need this many units of insulin to control this diabetes, or you need these medications to control this diabetes. But you forget that the diabetes wouldn't be diabetes if it weren't in a human being, and the human being is so complex. It's not just the diabetes, or it's not just how much the sugar was this morning. It's not a glucose of 300 or a glucose of 50 or 120. Like the person, it's a multitude of factors. It's mental, it's better, and not just feel better in terms of health, but spiritually as well. So that's why I think that we need to look at people and not the disease. The disease is just one small part of the person, and the person has the disease. The disease doesn't help, like when they know the person, like, who are you? What's your support system? Do you have a family? What are your reasons to be alive and fight this disease? Do you have the means to care for yourself, both like psychologically and economically and physically? Like, are you able to take care of yourself? Like if you have to inject yourself, are your fingers functioning well? But is your mind functioning well? Like, can you stand needles? I've had people who, they're prescribed insulin, and when they come to me, and I, usually when they come to me is because nothing is working for them. I just say, like, are you really injecting your insulin? And they say to me, not every 5 needles. And I'm like, so how come you have with heroin? So every time I see a needle, I think of my brother. It's obvious. Like, you're not going to be able to use needles until you work on that other aspect of your life that is so powerful. Or same thing with a patient that, he kept coming to the doctor, and the sugars were so high, and the doctor kept raising the insulin. And then again, they call me and they're like, Sandra, you go and talk to this patient because I don't know what else to do with this patient. And, as soon as I come in, I'm like, why don't you tell me what's going on? I mean, the doctor doesn't know what to do with you anymore. We want to help you. What can you do? Like, how can I help you? Like, what's really going on? And he says, well, the truth is, go into the pharmacy, I get the insulin, but I'm homeless. I don't have a place to put the insulin. So, but at the same time, it's like if consistently something is not going well, and you're trying, it's time also for the providers to look outside the box. If I keep raising the insulin a few times and it's still not working, ask yourself, like, maybe something else, right? I mean, it makes sense. And that's what I mean. Get to know your patients. Get to know, I had another case where this older lady, she would not get better. Same issue. You just keep increasing the insulin and keep, switching medications around, and you don't know what's going on. And this lady would not get better. She was like over 60 at the time. Well, just with talking to her and asking, how can I help you? I need you to get better. Help me help you. She was finally able to disclose, well, I'm getting the insulin and sending it to my son in Ecuador because my son also has insulin. There is no insulin in Ecuador and he cannot afford it over there. So I'd rather just inject myself just a tiny little bit and I send the other insulin to it. I mean, it's so many stories that I have. I could sit here and talk for about all these stories, but it's like, it's what the only way to me that you're really going to be able to help them. Because again, we are managing the person, not the disease. It's not about the medication, the right medication. Oftentimes it's not like that. And we have so many people with poorly controlled diabetes, and we're not doing enough for them as providers. We're not doing enough for them. And then people themselves, patients are not doing enough for themselves because they should speak up. That's what I always say. It's like, why didn't you say this 6 months ago? Like there are people who have already an amputation. Now it's when you're looking for help, and now it's when you're opening your mouth, it's too late. So I also, encourage all of my patients, like, you need to be open. Is that we know unfortunately the healthcare system nowadays is hard. It's not ideal. It's expensive. Doctors have to see 18, 20 patients a day. So you got to move super fast and you don't have all this time. But the thing is, me, myself, when I go to the doctor and the doctor is like, oh, okay, so this is what we're going to do. And this is the next treatment. This is your next appointment. Do you have any questions? And I get to ask one question and they're like, okay, so nice to see you after the answer. And I'm like, wait, I have 4 more questions to ask, and I'm right there. And I'm like, I make them wait. And I think, that is me. I'm, educated. I'm in the healthcare system. I know how to talk and advocate for myself. So imagine how many people are out there that don't know how to do that. Even for my parents, I'm scared when they go to the doctor by themselves because I know they are not going to get the quality of care that they deserve. So we as patients also need to advocate for ourselves. Like, no, you're going to sit down, you're going to answer my questions, you're going to explain to me why I need to take this medication. You need to hear my side of the story. It's not just what you're seeing in the chart, what you're seeing in my blood work, and what you're feeling when you touch me or listen to my lungs. There is a whole bunch of other things that you cannot see. And I'm the only one who can tell you about that so that you can help me the right way. So you know what? I think there needs to be teamwork between the healthcare providers and the patients. The patients need to speak up, advocate for themselves, tell their story, tell them what's not working for them. Don't be afraid. Like a lot of us, I know we were raised with this thing like the doctor is God and we should just say what the doctor says. That's not true. Like he is a person working with us, not for us, but with us. And we need to provide enough information to help the doctor do a good job as well. And the doctor needs to find the time to listen to all these stories because then the doctor is not only going to feel better as a person, but is going to have a lot more successful stories to tell. And it's going to learn from each patient. And from what they learn from each patient, they're going to be able to help the next patient. So they're going to become better doctors.
When you mentioned the example with the patient and, being scared of needles, or even other patients that you mentioned, how does one come about to become an advocate for their care, right? Because so now we know that if we're able to share and if we're able to do this right, then, we can get the help that we need as a patient. But how does one go about doing it, right? So one thing that you mentioned is we take the limited time that we have with the doctor, we try to squeeze in as much. And then after that, the doctor leaves and we may think of 10 other questions later to think of or ask or, coulda, woulda, shoulda, right? How does one go about becoming an advocate in the care?
And it's like, I forgot to ask. What I always tell my patients is every time that you think of a question, write it down and bring a list with you. And that's exactly what I do when I come to the doctor. And let me tell you, once I had a doctor that once I said, I know you need to wait because I still have more questions. The response from the doctor was, oh, well, then you're going to have to make another appointment because I don't have time for more questions. And yes, I made another appointment with a different doctor, because I thought this is important to me. Understanding my health is very important to me. If you're not going to dedicate my time, this is a doctor I don't want. And I did make an appointment again with a different doctor. And that's pretty much what I advise my patients to do. Like every time you think of a question, write it down and ask it as many times as you need to until you completely understand what you need to understand. For example, sometimes, unfortunately, as healthcare professionals, we speak this language that is so hard to understand. And I have to tell you, I've been both a healthcare provider, but I've been a patient. And obviously, my family has been patients as well. And I can tell you from my own experience, when I'm a healthcare provider, I have a very different mindset than when I am a patient or a provider, for my family. Like I don't understand things that they talk to me sometimes. And it's for a lot of reasons. Your emotions are involved. You just can't think straight because you're worried at that moment, either because of your health or the health of your loved ones. It's like a million things are happening through your head while you're trying to listen and understand a message that's being delivered to you, sometimes in words that we don't understand. And that's when we need to pause a little bit. And that's another thing. It's not only bring your list of questions, but oftentimes, like I have to tell my sister or somebody, like I need somebody to come with me because I know that I'm going to be nervous. And I know that first I'm going to forget everything that I'm told. And second, I probably am not going to understand because I'm so anxious and so nervous. So I need somebody else to come with me. And that way, when we come back home, we can like recapitulate and like go over it again and like, oh, that's what the doctor said. Right. I need to do that, Other thing, take notes. I do that. Like as the doctor is talking, just take your notes. That way you can go back to your notes and say, okay, wait a minute. What is this again? How is this done? How do I need to do it? And again, it's like you need to shop for doctors. Usually for a lot of people, you get an insurance card with with a doctor's name there, and you assume that that's the doctor that you have to see. And we need to have a good rapport with our doctors. And I'm just saying doctors, but it's just healthcare providers in general. We need to have a good rapport. It's like love at first sight. That when you go there, you feel like, yes, I can talk, I can be myself. I feel that I can tell this doctor anything or this healthcare professional anything that I want. Well, there are some people that you just don't have that chemistry with. You're not gonna be feeling as open. Like it's a little intimidating. I probably is gonna judge me if I do this. I remember once I went to another healthcare provider, and it felt very strange to me. As soon as I got into his office, I saw all these books in a different language, and a lot of things that were very, very foreign to me. And definitely, when we started the conversation, he was definitely foreign to my culture, and I was foreign to his culture. And he started asking me questions that were kind of inappropriate. And I understood it's not that they're inappropriate. It's just that culturally, we don't have this empathy, like this is a big cultural barrier between this provider and again, first time, last time. But that's what I mean. It's like you can't be afraid of walking out of a situation where you not feel 100% comfortable, because that's what you need for your health. You need to feel 100% comfortable, confident, secure that this is the right person to help you. Because when you feel that way, you start healing right away because you trust this person. There needs to be a lot of trust as well in this relationship. It's like, again, it's like a love relationship, like there needs to be love, there needs to be love at first sight and chemistry and understanding and trust.
So with that, Sandra, we're toward the end of the episode, unfortunately. How can our listeners truly connect with you, learn more about your work? How can they go about doing that?
Yeah, well, the easiest thing is search me up on LinkedIn. I'm right there. You're going to find my bio and part of the work that I do and samples of the work that I do. And yeah, if they have any questions, I'll be happy. I'll check my LinkedIn frequently, so I'll answer all questions there. But thank you, Shireen. This has been a wonderful opportunity for me to be able to reach out to people and tell them a little bit of my experience and what I think hopefully will be better for them.
And thank you for being on the podcast, because it's so interesting in your approach, how you're empowering patients. And I love that, because without a true collaboration, how can we really work toward a better goal and better health outcomes? So I love the approach that you take, Sandra. So with that, thank you again for being on the podcast.
My pleasure.
So find Yumlish on all the social media accounts linked in our podcast show notes. Our Yumlish socials help you learn more about our mission at Yumlish, keep you updated on helpful tips for managing your diabetes and giving you access to exciting opportunities with Yumlish. With that, to our listeners in Texas, Yumlish will be running a diabetes management course here in the Dallas region. If you are interested, email us at info@yumlish.com and we'll connect you over to that. Lastly, if you enjoy Yumlish podcast and know a healthcare expert working in the nutrition space, reach out to us on Instagram to nominate them. Send us a DM telling us who you want to nominate, what they do, and why you believe their work is making a difference in the lives of individuals to conquer chronic illness. Thank you again. Until next time, stay well. This episode of the Yumlish podcast is made possible by Anchor. Anchor is a free and easy way to create a podcast. Their creation tools allow you to record and edit your podcast right from your phone or computer. Anchor also distributes your podcast for you, so it can be heard across Spotify, Apple Podcasts, and many more. It's everything you need to make a podcast all in one place. Download the free Anchor app or go to anchor.fm to get started. Thank you for listening to the Yumlish podcast with Shireen. If you like our show and want to learn more, you can find information at yumlish.com. You can also leave us a review here. We will see you at the next one. And remember, your health always comes first.